Good morning, everybody. I'm Bersani. Today I will talk about the generation of motor neuron lines starting from C9 patients-derived iPS cells and changes in pathological phenotype of these lines after treatment with two different morpholino oligomers. So, as you know, C9 ALS is the most common genetic cause of ALS. And this work has two objectives. The first is to generate motor neuron lines from C9 patients-derived iPS cells, and the other one is to test two different types of morpholino oligomers on the generated lines, which are morpholino A, which binds the promoter of C9orf72 genes and silences the translation of the whole gene, and morpholino B, which only binds the expansion. So we generated our motor neuron line starting from iPS cells with a 2 weeks protocol, and we stained for DNA damage related proteins H2AX, as you can see on the right. And then we searched in qPCR for CDK and 1A, and they're both, as you can see, significantly increased in our C9 lines. Then we stained for R loops, and as you can see from the graph on the right, they are increased in our C9 motor neuron lines. Then we stained for motor neuron markers, beta-tubulin, VCHAT, and SMI32, and as you can see from the image, axonal development is somehow impaired in our C9 motor neuron lines, and so is the expression in qPCR of axonal length related proteins, which are STATMIN1, STATMIN2, SEP7, and heavy neurofilament. Then we treated our cells with our two morpholino oligomers, and as you can see, this is staining for SMI32. Axonal development is partially restored, and so is the expression of STATMIN2 and heavy neurofilament in qPCR. Then again, we stain for H2AX, and as you can see from the quantification of the fluorescence, H2AX is significantly decreased in treated motor neurons, and so is, as you can see below, the presence of R loops in C9 derived lines. So in conclusion, we can say that our iPS cells derived motor neural lines are a good model to investigate pathological phenotype of C9 ALS, and that morpholino oligomers are should be considered a promising therapy for C9 patients that still needs to be validated. Thank you so much for your attention.